I was thinking the other day about ridiculous medical practices of the past, like bloodletting and mercury medication. We've progressed our medical knowledge and technology a thousandfold, and I'm just so happy that I'm in the hands of competent doctors and not philosophers that think they know how the human body works.
Yeah, that may be true, but today's cancer treatment really hasn't been getting any better. We're basically poisoning the entire body and hoping it'll kill the tumor while killing so many healthy cells in the process.
But now here's the but. Okay, there's actually a way to circumvent this. See, tumors are like, as you said, ridiculously hard to treat with radiation therapy. They tend to be just as strong as normal tissue, and effective levels of radiation to kill the tumor also happens to kill the tissue. But there is a way around this, as I said, using nanotechnology. So researchers from the University of Victoria have made a breakthrough discovery. They found out that they can use nanoparticles to effectively aid radiation therapists to kill cancer-assisting fibroblasts, right? They're very similar to the fibroblasts you learn about in biology, the ones that are part of connective tissue, but they're actually recruited by the tumor to help, and that's terrible because that keeps the tumor going, on and on and on. They discovered that when you inject gold nanoparticles into the tumor, there are much higher levels of gold nanoparticles going into the cancer-assisting fibroblasts than the normal fibroblasts, which is huge because those gold nanoparticles can be excited by X-ray photons, react with water molecules, and create free radicals, which are compounds with one unpaired electron that damage the tumor cells. When radiation therapy is administered, doctors don't have to use too much radiation because they'd be killing these cancer-assisting fibroblasts that would thus prevent the tumor from becoming metastatic or prevent it from going further down this metastatic process. It's kind of like dipping your cookies in milk, right? You could just eat a cookie raw or like dry, but it's not as nice as just putting it in milk and then it's like easier to chew, right? It's the same thing. And now I think actually we have an expert here, Unchman, and I think you have something to say about how the chemistry behind this works.
Thank you. All right, so we know in fiction there's a lot of misconceptions about radiation, like, with the Hulk giving you superpowers, but that's not going to happen. It's the radiation for anything that's living is just terrible. So X-rays are really just pockets of electromagnetic energy known as photons, which have no charge or mass that originate from the electron cloud of an atom. This is caused by the energy changes in an electron's orbital, which causes it to move from a higher energy level to a lower energy level. This causes excess energy to be released in the form of high energy, high frequency ionizing radiation. And ionizing just means it can damage DNA. Now, X-ray photons are very energetic and have enough particles to do just that, damage DNA in living cells. Using X-ray photons, we can damage both cancer cell DNA and healthy cell DNA. Gold nanoparticles, from what you just said, will help us concentrate that into a particular spot.
Absolutely.
While you guys were talking, I was actually researching about gold nanoparticles, and I found they're actually very cheap compared to traditional cancer treating methods like chemotherapy, radiotherapy, and surgery. So traditional methods cost $30,000 a month, and gold nanoparticles only cost $80 a milligram. And this might sound like a lot because it's $80 a milligram, but nanoparticles is a very new field, and it's likely to become a lot cheaper in the future. Gold nanoparticles will also reduce the need of other cancer treating methods like chemotherapy, surgery, and radiotherapy. And this will allow patients to be treated faster. So what I mean by that is right now cancer treating methods are very painful and they have a lot of side effects. But gold nanoparticles will be a lot less painful and a lot safer as well. And I think Saj wants to talk about this as well.
In addition to what Sid was talking about, cancer is usually hard to detect in the human body. And all cures to cancer will actually damage the surrounding tissue of the cancer cell. On the other hand, gold nanoparticles are a lot safer and they won't damage the human body. Patients probably won't be inclined to try experimental cancer treatments that are very expensive and possibly dangerous. because it usually will take months to do, and they'll probably end up having to heal for a very long time. On the other hand, gold nanoparticles are much more safer and they won't damage the human body nearly as much. This will allow for faster patient healing time, which will allow for more patients to be treated. Also, cancer surgery tends to be very invasive to the human body, which is very traumatic to the body, and it will take a long time for the human body to heal. Whereas with gold nanoparticles, it won't damage the body as much, and it won't take as a long time to heal. And while these are all benefits to gold nanoparticles, there are also a few negatives. Some research has shown that gold nanoparticles can cause damage to the lungs, kidney, and the liver in Wistar rats. So while gold nanoparticles aren't exactly the perfect solution to cancer, they're definitely much better than the cancer cures that exist today.
So guys, what do you think about gold nanoparticles? I'm pretty excited for them because they seem very promising in cancer treatment, and just overall pretty cool to know about nanotech now.
Yeah, I think they're pretty interesting, and they seem like a good idea. As Saj pointed out, they're a lot cheaper. You don't have to put a patient through something like as intense as surgery or as intense as like a high doses of radiation therapy. So it makes it easier for the doctors and the hospitals, and it makes it easier on the patients. So I really think that's amazing. It's kind of like what like as I was talking earlier, it's like stopping a certain cell that helps the tumor grow and repair itself. So it's kind of like that story of that three-headed dragon, right? I think we're able to cut off a bunch of the heads right there just by being able to remove the part that the fibroblasts that actually keep the tumor growing. So that is really awesome. Just one question I had was what counts as nanotechnology? What does that really mean? I didn't catch that from anyone yet.
I'm pretty sure, like, first of all, like anything nano is one of its dimensions has to be within 100 nanometers. So and gold nanoparticles in this case are just very, very, very fine pieces of gold, right? You've seen gold dust, so it's basically that, but really, really small to the point that you can't see it.
Yeah,
Right.
but wait, I'm sorry, but what is a nanometer? I've never heard of that before.
Well, if I'm pretty sure a nanometer is a billionth of a meter. So
A billionth?
yeah, a billionth. If you could even imagine that.
No, I really can't.
I'm pretty sure a human hair is about 100,000 nanometers.
And it is kind of cool that those tiny things are just helping us treat cancers. Something that's
Like just to think
a
about
big
those
problem.
tiny things.
Big problem solved by small solution. I think we can wrap it up. Is there any more final comments?
No, I think we discussed everything. I just really think this is like really cool because my only experience with nanotech, gonna be honest, was just Big Hero 6. I think that was a lot for a lot of us.
Yeah, before this project, all I knew was Big Hero 6.
And even
Yeah,
then,
no.
there's microbots or nanobots. So,
Yeah, okay. We think we definitely made a lot of progress from there. So
yeah,
Uh,
100%.
yeah. that wraps
It's-
it up.
Yeah.